So on the touch panel, we do have choices for a child, a small, medium, and large adult, which have preset kilovolt and milliamp settings to get the optimal image quality for that typical size of patient.
Before we go on and talk about the details on that, why don't we actually get a patient in place and show them how we position it and how the lasers work, okay?
Fantastic.
Hey, Sissy, if you take your earrings off for us.
Okay.
I'll take them.
All right. These are kind of hard to get off, so give me a second.
I'll hold it
All
for you.
right. Okay.
Thank you.
We have a box of disposable bite sheets to go on the bite stick between each patient.
Okay, if you put that
Reduce
on for us.
cross-contamination. So we can adjust the height of the machine, or adjust the height of the column with the up and down buttons here. We can turn off and on our positioning lasers here. We can select our patient size. We have a child, and then a small, medium, and large adult. And each one has a preset kilovolt and milliamp option. So as I click on a setting, you can see this change. For our particular patient, I'm going to use an adult medium patient. For the image that we're looking to take, we want to do a standard panoramic image, but we do have options to take segmented pans, TMJ, sinus, bite wing, and a more orthogonal view of our bite wings or the posterior teeth, so there's minimal overlap. But in this instance, we're going to choose a standard panoramic image. Once we have our patient position using our Frankfurt plane laser, our mid-sagittal plane laser, and our canine laser, we can then put the unit in a ready position, and at that point we're ready to fire radiation and receive an image. So now we're going to go ahead and use the remote control to bring the machine down to the patient's height. And Sissy, I'm going to ask that you stand up as straight as possible, and I'm going to have you rest your hands underneath the machine on the orange ring, and then lean forward and put your anterior teeth, your front teeth, in a little groove that's on the bite stick. Do you feel that?
Uh-huh.
Do you feel like you're standing up straight?
I think so.
Okay, you look good. Take a small step forward to spread out your spine just a little bit to see if we can get a nice clean anterior view. And then I'm going to turn on the lasers using the remote control. Okay, now that we have our patient in the unit, I'm going to move the Frankfurt plane laser and have it line up from the patient's bottom of her orbital socket to the middle of her ear, so that we know that she's not having her head tilted down or tilting up. So we have a slight smile line in the panoramic image. We also have our mid-sagittal plane laser going through the middle of the patient's face. And with this RayScan, she does have a mirror, so she can help adjust herself a little bit to make sure that that laser is in the correct place. But it could also provide assistance by coming around the back of the patient. And then finally, we also have a canine laser coming across the patient's upper right canine. And if that laser is not hitting exactly where it needs to be, on the control panel, we can make adjustments there, or we can also make adjustments on the remote by moving the canine forward or backward so that the teeth are in the ideal focal trough for the unit. And once we have the patient lined up in the correct position, we'll have our 3 positioning lasers in the correct location, as you can see right now. At this point, we would be ready to hit the ready button on the unit or on the remote, and then we can fire radiation to get a good panoramic image. Now that we have our patient correctly positioned in the unit, I'm ready to hit the ready button on the control panel. And once I press that, the unit will put itself into a position where it is ready to fire radiation to get the panoramic image. So the unit will make a few minor adjustments right before the blue LED will turn to green. And once that LED turns to green, we can then go press the exposure switch and then get our image. All right, now that we've completed the exposure, we can release the exposure switch. We can then go remove the patient from the unit to make them more comfortable. And you'll notice on the computer screen, the image is being processed. You'll get a preview of the image unfiltered on the screen with the option to confirm it, to retake it if you prefer, or reject it. But we'd like to keep a copy of any image that we take, so we're going to go ahead and click on confirm. But before we do that, we can also notice that that same image is giving us a preview on the touch panel on the unit itself. Once we've finished acquiring the panoramic image, we can see the preview on the touch panel on the side of the RayScan Alpha Expert. We can choose to confirm it, retake it, or reject it. In this case, we've gotten the anatomy that we'd like. We're going to hit confirm. The unit will save the image, and then we can go back over to the computer screen and do any manipulations and reviewing of the image that we'd like.